In the earlier module, we have studied chemical properties of capsaicin, absorption, distribution and systemic activity and bioavailability of capsaicin. Now, let us study health benefits of capsaicin.
Health benefits of capsaicin. Capsaicin and weight loss. Epidemiological data revealed that the consumption of foods containing capsaicin was associated with a lower prevalence of obesity. A randomized double-blind study indicated that subjects between 30 and 65 years old with a BMI more than 23 kg per meter square treated with capsaicinoid 10 mg per kg per day for 4 weeks safely, the body weight tended to decrease during the second to fourth week period with increased maximum rate of oxygen consumption, that is VO2, resting energy expenditure and fat oxidation significantly. Enhanced lipid oxidation and increased energy expenditure are potentially beneficial for weight management. Now, capsaicin and cancer. Capsaicin exhibits strong anti-cancer activity through targeting multiple signaling pathways and cancer-associated genes in different tumor stages, including initiation, promotion, progression, and metastasis. Overall, the anti-cancer mechanisms of capsaicin include activation of apoptosis, cell growth arrest, and inhibition of angiogenesis and metastasis. Capsaicin stimulates the anti-tumorigenic, tumor suppressive signaling pathway and related transcription factors, whereas it inhibits oncogenic signaling pathways and tumor promoters. In addition, capsaicin interacts with other cancer preventive agents synergistically, providing the possibility for the potential use of capsaicin in cancer therapy with other chemotherapeutic agents. Capsaicin and metabolic syndrome. In obese mice, capsaicin injections exert an anti-inflammatory effect on adipose tissue, suppressing production of interleukin 6, that is IL-6, tumor necrosis factor alpha, that is TNF alpha, monocyte chemoattractant protein 1, that is MCP1, and cyclooxygenase 2, while boosting that of adiponectin and decreasing macrophages infiltration. Even dietary capsaicin intake also exhibited similar results in treating metabolic syndrome. The beneficial effects of capsaicin on metabolic syndrome in mice may be mediated in part by increased secretion of glucagon-like peptide 1, that is GLP-1. Indeed, gastric administration of capsaicin has been shown to evoke increased secretion of glucagon-like peptide 1 by the gastrointestinal tract. Now, capsaicin and pain management. Capsaicin selectively stimulates nociceptive neurons and has been widely used to study pain-related events. The pharmaceutical effects of topical capsaicin applications are based on their action as agonists of transient receptor potential vanilloid receptor subtype 1, that is TRPV1, which is a ligand-controlled non-selective cation channel expressed on nociceptive fibers. TRPV1s are heat-sensitive receptors activated at temperatures between 37 and 45 degrees centigrade. Expressed at the level of free nerve endings, their activation causes a burning pain sensation. TRPV1s can also be activated at basal temperatures where they are bound by exogenous ligands such as capsaicin. Nerve damage causes the upregulation of TRPV1's expression in injured C fibers, which leads to a pathological amplification in the transduction of heat signals, interpreted as pain. A single application of high concentration capsaicin or repeated applications of low concentration triggers a desensitization of TRPV1s expressing free nerve endings through a yet unexplained mechanism. This leads to a temporary retraction or destruction of epidermal free nerve endings. The result is a reduction of nociceptive input from the treated region, possibly leading to a reduction of pain in peripheral neuropathy. However, topical application of capsaicin also causes a transient local erythema due to the release of neuropeptides during the capsaicin-induced neurogenic inflammation. Now, capsaicin and analgesic effect. The effects of capsaicin on nociception are not limited to its ability to produce pain. In fact, high or repeated doses of capsaicin induces an initial pain sensation that is followed by analgesia. This loss of sensitivity to painful stimuli was noticed in response to not only thermal but also mechanical and chemical noxious stimuli. The underlying mechanisms in capsaicin-induced analgesia are being increasingly studied. After exposure to a high or repeated dose of capsaicin, the TRPV1 receptors begin a refractory state commonly termed as desensitization that leads to inhibition of receptor function. Capsaicin-induced desensitization involves mechanisms not entirely understood. There is evidence that this process includes depletion of neuropeptides such as substance P in the nerve fiber that express TRPV1 and an increase of intracellular calcium levels by inhibition of high voltage activated, that is HVA, and low voltage activated T-type calcium channels. Now, capsaicin in glucose homeostasis and diabetes. In addition to the effect of capsaicin on body metabolism, this pungent compound may also have beneficial effect on glucose and insulin homeostasis and diabetes. Dietary and supplementation with capsaicin display an impact on glucose and insulin levels in humans. Regular consumption of capsaicin containing chili attenuates postprandial hyperinsulinemia in healthy adults, and supplementation with it improves postprandial hyperglycemia and hyperinsulinemia in women with gestational diabetes mellitus. Now, capsaicin and cardiovascular disease. There is evidence that capsaicin has potential beneficial effects on the cardiovascular system. The cardiovascular system is rich in capsaicin-sensitive sensory nerves that play a major role in regulating cardiovascular function through the release of neurotransmitters such as CGRP, that is calcitonin gene-related peptide, and substance P. CGRP is considered to be one of the most powerful vasodilators and plays an important role in regulating blood pressure under both physiological and pathological conditions. Capsaicin stimulates the release of CGRP through the activation of TRPV1 and therefore decreases blood pressure. However, the protective effects of endogenous CGRP rely on the intact function of capsaicin-sensitive sensory nerves since high dose of capsaicin treated. However, protective effects of endogenous CGRP rely on the intact function of capsaicin-sensitive sensory nerves since high dose of capsaicin pre-treatment which selectively depletes transmitters in capsaicin sensory nerves could abolish the protective effects of CGRP or even enhance hypertension. Capsaicin has been shown to inhibit platelet aggregation, which may also provide protection against cardiovascular diseases. Capsaicin's anti-aggregating effect on platelets is attributed to the alteration in the fluidity of platelet membrane. Now, capsaicin and gastric disorders. Sensory neurons are responsible for maintenance of gastric integrity. Therefore, the gastroprotective effects of capsaicin lie in the modulation of the sensory neurons, since chemical ablation of these neurons mitigates capsaicin protective effects. Daily treatment with 400 microgram of capsaicin 3 times a day reduces ethanol and indomethacin induced gastric mucosal damage in healthy human subjects. The gastroprotective mechanism of capsaicin is due to the activation of TRPV1 at gastric sensory neurons, which stimulates the release of CGRP. Helicobacter pylori is one of the main causative agents of gastric ulcer, and its presence correlates with use of non-steroidal anti-inflammatory drugs, that is NSAIDs. Capsaicin reduces Helicobacter pylori induced gastric ulcer by reducing interleukin 8 production.
Capsaicin is an active component of chili peppers, which are plants belonging to genus Capsicum. It is an irritant for mammals including humans and produces a sensation of burning in any tissue with which it comes in contact. Capsaicin and several related compounds are called capsicanoids and are produced as secondary metabolites by chili peppers, probably as deterrents against certain mammals and fungi. Capsaicin is used as an analgesic in topical ointments and dermal patches to relieve pain, typically in concentrations between 0.025% and 0.1%. It may be applied in cream form for the temporary relief in minor pains of muscles and joints associated with arthritis, backache, strains and sprains. It is also used to reduce the symptoms of peripheral neuropathy, and it has been found to be beneficial in obesity, diabetes and cancer. Thank you.